getting COVID-19, I was scared. I mean, after doing 25 years and getting a board date to be released, and then weeks later finding out I had COVID, I thought I was going to die in there. So, yeah, I didn't really think that I was going to make it out.
Is a life worth less if it is inside of a prison? Of course the answer is no. The right to personal safety is an ideal upon which our country rests. Throughout history, there have been incidents which safety has been compromised, but one group of people remain uniquely overlooked. As lives are lost in the day-to-day crisis that is the COVID-19 pandemic, the incarcerated remain the forgotten population.
U.S. state and federal prisons have seen a very disproportionate hit in terms of COVID-19 infections and fatal outcomes or deaths.
The rate of COVID infections and also the rate of COVID-related deaths are just extremely elevated in prisons in particular, and also in jails. We've seen that, prison and jail are a place where we can't actually implement a lot of the things that we know are best practices in public health in terms of preventing COVID.
In the United States, 1 in every 20 people of the general population has had COVID-19. Inside our prisons, that number quadruples to 1 in every 5 people. There are over 8,000 current cases among inmates and staff in the federal prison system alone.
Things like wearing masks or engaging in acts of personal hygiene, like hand washing or using hand sanitizer. You just don't have the same access in prisons that you have in the free world. You can't use hand sanitizer for many inmates across the country. You're issued a quantity of soap when you're admitted to prison, and additional soap has to be purchased.
People do not have access to PPE, and that's a problem. But even if they had perfect access, that would not solve the larger issues.
I mean, one issue that's pressing always in prisons, that not just during this time period, but in general, is just the issue of prison overcrowding.
Ultimately, our jails and prisons are just not structurally really set up to do social distancing in a humane way.
With their close quarters, multiple people per cell, and circumventilated air, there is no escaping the virus inside of a prison or correctional facility. The dangerous situation that prison conditions propose for those inside indicates a clear need for extra protective measures. The measures taken, however, have been few and flawed. For example, personal protective equipment, or PPE, was distributed nationwide, but there are complaints about the masks not even being worn.
Compliance with mask wearing among staff and among inmates. Are you able to get full compliance for simple mask wearing because you are challenged with confinement and closed spaces?
I just saw a memo a few days ago saying it's mandatory. I'm thinking, well, wait a minute. A mandatory mask came out for the staff in June.
If we really want to address this problem among the incarcerated populations, I think, one, we need to depopulate.
We want releases. We want releases. That's it. There's people in there you can release. There's so many people that you can release.
Compassionate release, more distribution of PPE and replacement of unsanitary PPE items, and more strictly enforced and frequent standards of COVID testing for the staff are only a few approaches that could help save the lives of thousands of people.
Our pandemic response has often been mischaracterized in public forums, which is unfortunate, since we have worked closely with the Centers for Disease Control to develop the best COVID-19 plan for correctional environments. Our procedures have proven effective.
Some dispute the calls for action to protect those in prison, citing economic issues, questions about accountability, or simply a lack of necessity. But the flaws in the system are visible even from the outside.
The new administration should come up with a top-to-bottom plan for promoting public health.
While it is true that the prison system is complex and has many moving parts, from jails to federal prisons, it is also clear that none of these systems have done an adequate job at saving the lives of those inside. The crisis has gotten so out of control that the responsibility of stopping the spread in prisons can rest only on our legislators and commander-in-chief.
I mean, this is why we have the Senate and we have the Assembly. They're there for a reason.
We urge Congress and the President to pass legislation establishing high unified standards on how the incarcerated population should be treated during this health crisis.
We have become a country where we are willing to let people die, either because they've been accused of a crime or they've been convicted of a crime.
These people were sentenced to do time for a crime. They weren't sentenced to be killed.
The incarcerated population is one of the most vulnerable, and we cannot continue to let them suffer. This issue needs urgently to be addressed so we can ensure that the incarcerated no longer remain America's forgotten.